fellow practitioners, thank you for taking the time to join me today to watch this video. If you're watching this video, that means that you're interested in learning a little bit more about down needle therapy. It also means that you're somebody who's interested in learning more tools and techniques and growing your own personal practice and finding more things that can help your patients feel better, move better, perform better. So I commend you for that. So thank you for taking the time. I'm certainly respectful for anybody who's willing to learn more and kind of push the edge and help our medicine, help any sort of needling techniques grow, because I love and appreciate all the ancient wisdom, but we're learning and moving and integrating things as we learn more, and we're helping things evolve. So you're watching this video, you're participating right now in the evolution of our practice. So thank you very much for that. I'm going to make this quick. I'm going to make it a little more informational, but we'll be brief here and try to give you as much information as possible so you can get on with your day. A little background: my name is Brian Bowen. I am a licensed acupuncturist in Denver, Colorado, and own Integrative Health Inc., which is located in Greenwood Village, Colorado. I'm also been practicing manual therapy for 25, 26 years, somewhere in there. I'm a corrective exercise specialist, a postural alignment specialist, certified personal trainer, high performance coach, and an MBA. I love all things health and wellness. I have some other health and wellness businesses. So I am all in on health and wellness. I love to continue to learn. I love to learn from other modalities, even though maybe I don't 100% practice, personal training. I love to get information from different people. I love to learn about the human movement system and how it can move more efficiently. What other perspectives do I need to bring in to help open my mind up and how things fit together? And so, although I immensely respect all the traditional ancient wisdoms in our texts, I'm also somebody who is looking and learning about more research and things that are available to us now with our knowledge, and learning about those and how do we incorporate it? How do we get things to evolve a little bit more? How do we take things to the next level? So by watching this video, you're helping take things to the next level. So that's a little bit about me. Down needle therapy, I've been practicing and utilizing the down needle, which is a specialized style of needle. It's still a filiform needle, but it has a beveled, chiseled edge to it. And it's actually called the knife needle. I trademarked the name Dao needle. Dao is actually a Chinese word for knife, just to kind of rebrand it, to take away that harshness in our Western world of the intensity of what that sounds like. Let me just preference this. 90% of people that come into my office that have had dry needling, down needle hurts way less. So I just want to get that out of the way, because when I talk about a beveled, chiseled edge, some of you might be, sounds intense. It's not. Never assume who can handle what treatment. If you are learning about a tool, if you're learning about a technique, right, and it's morally and ethically, it's the right fit for this person, then you have to try it. You always empower your patient. You're always constantly empowering your patient for proper communication on if it's the right fit. So they're the ones who help you decide that. I like to jump all over the place, so I guess I shouldn't have started this whole conversation with this. Is going to be quick. I apologize. I am somebody, though, who likes to have tools in my toolbox. Down needle, I will never claim, is the one tool that fixes everything, and nothing is. There's a certain amount of, there's different tools out there for certain conditions, right? And we have to learn and understand these tools and when they're applicable. And that's what makes it fun. That's what gets you guys. That's what gets me excited. Otherwise, I get bored out of my mind. I like to have a variety of tools that I can integrate, and I can listen to my patient, and I'm just thinking about, oh, this would work well with this, or I need to do this, or they've already done these things, so it's time to do something different, right? So you have to have 3 Ps. You have to have purpose, passion, and playfulness, okay? Now, I know you're watching this video, so I know you have the purpose and I know you have the passion. So I'm going to help give you some tools to allow you to be able to be more playful. So we should always be engaging playfully and as much as we can, and connecting and empowering with our patients. And that's one way to do it. So, really being an active listener, really hearing where they're coming from, finding out what they've done before, finding out of your toolbox, what is indicated and what things fit well together. And so down needle does a beautiful job at that. It's a tool that I'll do it a standalone by itself, right? There's no needle retention, but I'll also integrate other therapies into that. So maybe I'll down needle and then I'll do regular acupuncture. Maybe I'll down needle, hit a little dry needle on a certain spot or motor point or trigger point. And then I'll do regular acupuncture. Maybe I down cupping. So there's many different ways that you can incorporate it into your practice. Okay. But its bread and butter is stubborn pain. So chronic pain, 100% Dow it up, baby. Acute pain, fantastic. Sports performance, right? Even if they're not having a lot of pain, but you're understanding the imbalance of that hypertonicity and hypotonicity and what needs to be turned on and what needs to be reduced, what's too tight, what's weak. So there's different techniques of Dow needle therapy that we incorporate for these certain things. There's different techniques that we use for hypertone tissue. There's different techniques that we use for hyperactive tissue. There's different techniques that we use for hypertone, weak tissue. There's different techniques that we use for scar tissue. And so the cool thing is, even within the technique itself, there's a bunch of different styles and tactics that we incorporate based off those variety of things. Now, again, I totally respect, all of the traditions of Chinese medicine. I totally respect all of the meridian theory and all that yummy stuff. But I also like to take and bridge what we know in the world of orthopedic and sports medicine and incorporate those tools. So the one thing that Dow needle does, so first of all, it's a different needle, it's a different shape, different tip, right? Different gauge. And I've spent a lot of time using what's called a force gauge to check the mechanical threshold of Assure points, which, by the way, we use as a therapeutic meter. In Dow needle therapy, you learn at a whole nother level how to utilize Assure points for information, right? How to utilize them to find out what was first, the chicken or the egg. Where's the dysfunction? Where's the compensation? Where are we going to go first, right? That's just one tool. We have a complete mapping system that you can utilize, and that in itself will take your treatment to the next level, right? Utilizing the mapping system, understanding the Assure points, utilizing the different needle, utilizing the different techniques with the needle on those points is tremendous. Okay. So that's worth its weight in gold. So if you just want to take the foundations class, get a deeper understanding of Assure points, understand and learn the mapping system, start utilizing the needle, learn a bunch of different protocols, whether it's cranial-fascial needling, whether it's cervical spine, whether it's the hip, right? Whether it's plantar fasciitis, whether it's small joint and range of motion, understanding motion palpation. Like, that's just a small little chunk of what you get in the foundations class. When you fall in love with it and you start incorporating it more, the one thing that we did not get enough of, and maybe I didn't get enough of it, but I've taught all around the United States within different schools. I teach in Toronto, and now we're in the UK. And I have a really good understanding of that we are missing as a whole, really, much more in-depth orthopedic sports medicine parts of the program. There's a couple schools that excel at it. There's a couple schools that are really great. But I understand it's really hard in 3.5, 4 years, whatever, to learn not only all this stuff about acupuncture. Maybe you're doing the herbology with it, right? Maybe you're doing all these things. It's really hard to master it all. I've been practicing, again, for 26 years, and I still have to restudy stuff I've already studied, right? It's hard because I'm so passionate about the human movement system that I want to learn more. I want to keep building more into my repertoire, into my toolbox. And so, when we're trying to understand, everything about the joints and antagonist-tagonist relationships and how things move, it gets really complex. So my point of telling you that is we need more diagnostics and differentiation. If we're going to be true to our medicine, and if we are truly going to treat the root, right? If we're really going to treat the root of the problem, then we actually need to live up to that. We need to understand what the root of the problem is. So it's more than chi and blood stagnation. I promise you, like, if it were that easy, chronic pain would be easy, super easy to treat. But we are in a world of input, and people are constantly getting input in from their environment, from the way they walk, from the way they sit, from the way they sleep, from the way they move. And all this input's coming in. Our job is to discern what is bad input and what is good input. So understanding bad input, connecting with the client, empowering the client, really understanding their story, really understanding what all is happening in their world, right? And that empowering part is critical because then it rolls into the active portion of our therapy. So we have to have a marriage of passive and active therapies, right? Because otherwise it's us against everything else they do out in the whole world. And so it's our job to help coach them. So for our treatment strategies to become more successful, for them to move up to that next level and get them out of this symptomatic phase and get them in long-term correction and getting them to really be preventative and understanding their human movement system, how they move, what that means, what that proprioceptive input is. That is truly treating somebody at the root. Okay. But we have to learn more tools. So once you fall in love with the foundations, once you've discovered and utilized how to measure these Ashur points and what they mean, and the grading system and the mapping system, some of the motion palpation, and understanding how the needle's different, and understanding needling scar tissue and all the different protocols that we go over. Once you fall in love with that, then we have a level 1. So foundations, level 1. And level 1, we're going to give you more tools to work with. So we build off the foundations, okay, into the level 1. Level 1, we start understanding how the myofascial system overlays the traditional meridians. We start learning how to look at a posture, right? How to look at a posture, how to map it, and how to chart the posture, how to take what we see. I don't know why I pointed here, how to take what we see, and then chart that out, then understand by what we're seeing, how that relates to what fascial lines or what meridian lines. Then we have to validate that hypothesis. So we're going to do some functional tests. So there's certain functional tests for each part of these lines. And it seems overwhelming just talking about everything I'm talking about right now, but it's really simple. I've been working harder and harder and harder to simplify this, to give you guys cookie cutter templates and stuff to work off of. When I first started this, I had everything in one, and I've overwhelmed everybody, even overwhelmed myself sometimes. So I've reduced it, and it's getting better and better and better. And so now we're getting ready to launch this huge new platform that is going to have a ton of amazing stuff. But I digress. Sorry. Level 1. So we're learning about the fascial system and how it overlays with the traditional Chinese meridians. We're understanding how to see posture, how to take what we see, chart it, understand what lines we might test, right, to where true dysfunction is. Then what we'll do the test. Then from there, we get into the patient position. And I'm going to pause just for a second. So even in foundations, level 1, level 2, patient positioning is something we're missing out on. This human movement system, all these attachments, all this inert tissue, all this contractile tissue hooks into all these like little nooks and crannies, right? And it's dynamic balance. It's so intense. I don't know how more stuff doesn't go wrong. From every action I do, something has to engage, something has to let go, something has to tell my brain in seconds things are happening, right? And so we need to understand patient positioning as it relates to what we're needling. So we have to understand the tissue we're needling. Is it contractile or is it inert, right? What position do I need to put that patient in? We have to bring the tissue to us. We got to get in those nooks and crannies. So sometimes our treatments are not as effective because our diagnostics and differentiation are totally off because we're not spending the time doing the diagnosis and differentiation because we don't have the tools. 2, the depth is inaccurate because we're not understanding the depth of palpation where we should be needling and what tissue it is. Or C, you're just in the wrong place, right? You're not getting to the tissue. You need to move the joint. You need to move the body. You need to put them in different positions. And so we go over all the patient positioning in foundations and in level 1. So level 1, you go from posture, charting, hypothesis, test, functional test, patient positioning, bring in the components of the foundation class, and then you start your needling. It's amazing. Then we go to level 2, and level 2 is super fun. Level 2 gets into the fine details of even taking it to another level. You can almost think about level 1 as we're treating excess, level 2 as we're treating deficiency. And so we start to do proprioceptive neuroresponse testing. Okay. And so we need to see who's weak. How can we get that engaged? Because in level 1, we do the functional test to understand where there's restriction, where there's constriction, how to release that, but then we give them homework. And again, passive and active therapy. We give them homework because we're getting momentum going, we're getting the ball rolling, and we want them to have tools that they can do and give themselves that input on a regular basis. Okay. So level 2, we're understanding where the deficiencies are. We're understanding who's not firing, right? Who needs to be turned on, who needs to be engaged, and we needle it differently. So we learn neuroproprioceptive response testing. We learn how to needle it. We learn how to retest it. And then you're giving more tools for them to go home and reinforce the message into that tissue. So if somebody's coming in and we're just putting them on the table and we're treating them, and we haven't taken something away from them and we haven't given them something, we're not doing our job. 70% of the reason why people aren't getting better is the things that they're still doing on a regular basis that is impeding our progress, right? So we need to understand what those things are. We need to find them. We need to take that log off the fire, and then we need to throw water on the fire. So when they leave my office, they're going home with something to do. They're going home because I want them to be a part of the process, and we have to have that input in to continue to get that forward momentum, to continue to get over that hump, to continue for true long corrective care. So again, what is down needle therapy? Down needle therapy is a system that uses a specialized style of needle that's unique, that's more powerful, that's more potent, that's stronger at breaking the chronic pain cycle, breaking up scar tissue, breaking up adhesions. It gives you tools, more diagnostic and differentiation tools to really understand where the true problem is. Tools like the mapping system, tools like the postural analysis system, tools like the neuroproprioceptive response testing. I love saying that, neuroproprioceptive response testing. And gait analysis. I mean, I can't even tell you how many tools you're going to learn, but I have workbooks built for all of these that I've spent years building. I'm coming up with a book here, hopefully soon. I'm already 6 months behind schedule, but it's going to come out. I have an online institute, the Down Needle Therapy Institute, which is recordings from my live classes, but also a lot where I'm in my studio and I'm filming things. And you get great close-ups and you get to see this. It's got tons of material, tons of video, tons of workbooks. And then there's other components to that as far as you have to send some videos to me. I get to analyze you and judge you a little bit. So I encourage everybody, well, first of all, again, thank you for taking the time to watch this. I hope this is a nice, sweet video. I think I probably missed 50,000 things that I want to tell you, but there's a lot to it and it's fun. And so passion, purpose, playfulness. If you come to my live course, you're going to get it all. You're going to get more. If you're watching the online course, you're going to get a lot of it. It's more fun in person, but it's great online. And we also just launched a master's class that we just had in Toronto, which was amazing. You have to take at least the foundations to the masters. Look at our website, downneedle.com. Okay. We're getting the ball rolling again. We had a little hiatus with the whole COVID thing. But we're moving forward. We got a lot of fun stuff, a lot of new things coming that will be available to you guys. So stay curious, practice with purpose, passion, playfulness. Check out DAOneedle.com, DAO needle.com. Go to the register page. It'll tell you where our classes are. We have a class coming up. I can't say when this is because then it's going to timestamp this video and I got to edit it all again. But we have classes coming up. The online institute is fantastic. If you don't have the means to travel or you don't have the time, you're watching this video now, so I know you have the time to do the online. So if you have any questions, please reach out to us, info@downneedle.com. Again, Brian Bowen, Down Needle Therapy. Thank you guys for growing and moving the ball forward and helping your medicine evolve. Thanks.